Okay.
Hi everyone, and welcome to the Spanish and Shadowing 2022 Open House. My name's Patty, and I will be introducing the staff that's here with me in just a few minutes, but I'll give you a couple of minutes as I still see people hopping on, so we'll just give them a minute or so to join us. And again, for those of you just starting to come in right now, this is the Spanish and Shadowing 2022 webinar open house, where we're hoping to provide you with a lot of information about the program, about what to expect, and hopefully I'll be able to answer a lot of your questions as well as we're going through. You can write your questions in the chat box. You can see a panel of staff that's here with me today, and we'll just give it about 30 more seconds and we'll go ahead and start. But if you do have any questions, you just received a message from Carolina, and the rest of us, our staff as well, is standing by for your questions right on that chat box. So if I don't get to your questions while I'm speaking, the staff will help me out by answering them or reading them out, and then we can talk about them as we go along. We are live, so excuse any blunders that we might have just going through this. So I just want to welcome everybody, and we're going to go ahead and start. The session is being recorded, so if you do want a copy of it, you can definitely speak to your advisor to get that. I wanted to introduce the staff that's with me here today. First of all, I have Cassandra on the line. Hola, Cassandra. There she is. Cassandra is currently out of Chile. She is in Valparaíso, a UNESCO site, just about an hour and a half from Santiago, half an hour from Viña del Mar. But Cassandra comes to us from Scotland, and she is well versed in understanding what it's like to come to a country, a Latin American country, knowing a little bit of Spanish at first, but being able to have conversations and understand a little bit more and become empathetic with the local culture. We also have online with us today Karen. Hola, Karen.
Hi, everyone. Hola.
Hi. And Karen is in the far, far south of Chile, and she is close to Puerto Natales. But Karen comes to us as well from down under, from Australia. So welcome, Karen. Karen as well has had the opportunity to travel to Chile and other Latin American countries as well, understanding what it's like to be a little bit new in the country, starting to understand the customs and the habits of people here in Latin America. So she can definitely tell you a little bit about what that's like. And also with us today is Stephanie. Hola, Steffi.
Hello, everybody.
Hi, Steph. Steph is currently on vacation in Chile, but she lives in Colombia and has been all over the planet, knowing she also lived in Canada for a while. So Stephanie can also give you a lot of information with regards to travel, with regards to what is required in each location, as well as having that background and understanding what it's like to be new in a country, not only with regards to language, but also with regards to culture. And I have repeated culture a lot because, you know, we'll go into that and see how important it is to your language learning experience. And talking to her puppies that I know are right behind her is Carolina. Hola, Caro.
Hi, everyone. I was just getting rid of the squeaky toys.
A squeaky toy, of course, right? Trying to keep the puppies behind her calm for our session. We are, it's about 8 o'clock here in South America. So we are all working remotely and bringing this webinar live to you from our home. So if you hear, you know, a puppy in the background or, or something like that, again, we are live and we are remotely all connected to you. All right. And as I was saying, Carolina is here with us today. Carolina is the assistant director of the program, and she is helping me on the technical end of things because I'm not good at that part. So there we go. We're a team. Carolina's family lives in the United States, and she travels back and forth a lot, and she knows firsthand from her family what it's like to have to seek healthcare in the US, sometimes when there's a language barrier involved. So she can definitely empathize with that part of the program and understand and relay to you all of that as well. All right, so thanks to the team for being here today. We're all waiting for your questions on that chat box as we go along. But I wanted to first start by talking about the elephant in the room. I always say that. And I think that with today's news, it's right there. It's right in front of us. And a lot of students are asking me, hey, Patty, what's going on with COVID? So yeah, so we've been hearing a lot of information coming to us from the United States and from Europe. And I must say, thankfully, we are not there. We are not at that level that you are seeing in the United States and in Europe. And I think that's because we are behind with regards to the virus, but really ahead with regards to vaccination. So that has been something that's been helping us here in Latin America a lot. Okay, so it's really important to us to let you know about what's going on. All our schools are currently open in Argentina and Chile and Costa Rica and Ecuador and Peru. And there are some restrictions with regards to how to travel. So if you do have questions with regards to that, we will be discussing that with you on a personal level, because it really depends on where you're going, what time of the year you are traveling. But things like having a 72-hour PCR test, having your vaccine passport, and all those kind of things will probably be in the conversation. All right. But like I said, things here are thankfully still in control, and we're really happy about that. Of course, we are taking the precautions requested by the local authorities, keeping social distance. We all wear face masks in public places. Frequent hand sanitization is really important, and as well as sanitizing the rooms, the classrooms. So when you do arrive, we do have a policy of having frequent breaks to make sure that we're airing out the rooms and sanitizing them appropriately. If you have any more questions with regards to COVID and that kind of thing, feel free to connect with us. You can write in the chat box, have questions about COVID, and one of our advisors will connect with you and provide you that information as well. Okay. All right. So let me tell you a little bit about us and about who we are. We have been around for over 20 years now. This program has been established for quite some time. We started with regular Spanish, but this particular program, the Spanish and Shadowing program, has been around since 2002. And way back then, we started our program with 3 students from Chicago, and we called them the Chicago Hope Group because of the TV show back then. I don't know if any of you remember it. You might be too young to even remember it, but that's how long we've been around. Since then, we've seen over 800 students go through our program. Really excited about that, because we know that those are students that are currently, or a lot of them are currently healthcare professionals. You know, they came through the program when they were students, and today they are actually out there helping people. And we as staff and our teachers at the schools know that when we are providing you with that knowledge, when we are expanding your knowledge, and we are providing you with the tools to be able to communicate, that could be one of us, one of our family members, one of our friends that is seeking healthcare in North America, that's going to have that help, that assistance, that support of somebody who's able to communicate with us in Spanish, right? There is definitely a language gap happening in the United States right now. If we consider, and a lot of people don't know that the United States has the second largest Spanish speaking population in the world. Okay, only second to Mexico. So that means there's more Spanish speakers in the United States today than there are in any country in Latin America, or Spain for that matter, only second to Mexico, like I just said. So that's a huge number. That's over 50 million Spanish speakers in the US. So whatever area you're going into, and especially in healthcare, you will definitely encounter a Spanish speaker. And most likely that Spanish speaker may not be able to communicate appropriately in English. It's not that they don't want to learn, you know, it's not that Spanish speakers feel that they don't have to learn English, it's just difficult. Okay, because of so many factors that are involved. Usually these people come into the United States when they're a bit older, not as young as students. So a lot of them don't have the opportunity, the time, the money, the energy, or the skills sometimes to be able to pick up a second language. So it's difficult for Spanish speakers. And with that sheer number, we do have to take into consideration what's going on with this group of people. Okay. As a not-for-profit organization, the Shadow Abroad Foundation has a mission to make sure that we provide that opportunity for healthcare providers. Okay, it's not only for the patients. It's not only for the patients. I think, you know, patients really appreciate the fact that they're able to connect with their healthcare professionals in their language, because it just makes that bond that's necessary so much, you know, easier. But also for you as a healthcare provider. Not too long ago, I was talking with a former student of ours, and you know, she's practicing right now, and she was telling me, she said, Patty, I get it now. You know, it's been several years, but I understand now why it was so important to do this, because I go through all of my cases, she said. I run through all of my cases that I've had during the day, just to make sure, you know, I didn't miss anything, or if there was something I could have done differently. And when I'm doing that, I understand that if I didn't have the skills to have been able to speak to my patients that day, it would have just added to that burden of sometimes thinking, did I do that right? Did I get them all of the information, all of the help that I could have? And that's on you as well. And we want to lift that burden as well from our students. Okay, so think about it that way as well. You're not just doing a service for others, but also for yourself. That's just a little bit of what we do. All right. As I was saying, it's really important, and I just did mention something about the bond, right? The bond that happens with the patient. And this slide here says that when a healthcare provider can speak to the patient in their own language, the patient feels like a welcome part of the community. And I can't stress, as well as the daughter of immigrant parents myself, how important that is to Spanish speakers. Okay, being a part of the community is something that they strive to do on a daily basis. Wanting to feel a part of that great nation that is the US is something that is part of their desire when they leave their country. A lot of people, you know, leave their homes because they don't have an option. Okay, it's not easy leaving behind family and friends and everything you know is home. Not knowing when or if you're going to be able to return to that. And that's the difficult thing to do. And so when you arrive somewhere, you know, you've got all this energy and all this will to become part of this community. And when the language barrier is stopping you from doing that, when you want to get there but aren't able to because of your age, because of time, because you're holding down 2 to 3 jobs, because you don't know how much of it is actually going to be able to sink in, because maybe literacy isn't your forte in your own language, it's difficult. So when you are able to create that bond and make that person feel a welcome part of the community, like they're not bothering you, we're here to help you, we're here to take that burden off. When we are ill, we're at our most vulnerable, I always say. And you know, adding to that, the fact that you can't communicate. I mean, put yourself in that situation. I know all of you are here thinking about traveling to Latin America and how great it could be and all of these wonderful things that you're going to learn. But you have us, right? We're backing you up. We're supporting you. Should anything happen, if you needed, you know, some healthcare during your trip, God forbid, there is somebody here for you. All right. Imagine if we weren't there. Imagine if you had to be in a place where you didn't understand, where you couldn't express what was wrong. How would you feel? Right? And that's a part of our mission and our objective, is to be able to lift that burden and to bridge that gap. And we really want to work with students who understand that, who feel that that's an important part of what you're going to be doing. Right? Direct communication creates an important bond with the patient. And, you know, a lot of times we say, yes, the bond is important, but why is it important? You know, what is it about that bond that's going to allow you to be a better healthcare professional? It's not just about, you know, being friendly and, you know, just making new friends. It's about being able to understand a little bit more and another tier and another level of what's going on with your patient, right? One of the things that you probably speak about in your classes is getting that story, right? Getting the records, getting the history. There are things that you're going to be able to understand about your patient when you are able to communicate properly, when you're able to create a bond where that patient has the sensitivity to be able to open up. And also when you're able to look at things from the perspective of culture. And here's that word again that I used a lot in the beginning. And I use that word a lot because we truly believe that culture and language go hand in hand. You can't have one without the other. And I know I sound like a commercial from somewhere out there, but yeah, you can't really have one without the other. It's difficult to understand somebody when you're just making the equal sign between the words, right? It doesn't always mean the same thing. Inflection, sounds, culture mean different things. And one of the reasons that we create this program to be able to take you from country to country is so that you will not only learn the languages, the differences in language, the intonations, the accents of the different locations, but also the differences within the culture, because they're so important to understand. You know, we always talk about, for example, making the analogy with food, right? We all love food, and it's kind of like dinner time around here as well. So we're thinking about that. And when I talk about food, I always say, you know, when you're traveling through South America, there's something that we all have in common. We all have that fried dough, that empanada that I know most of you have heard of, right? An empanada is like a beef patty, but it's different when you travel within South America, right? So if you're having empanadas in Argentina, okay, they're likely to be filled with meat. All right, because Argentina is a big producer of meat, and meat is a really important part of their diet. But that also tells you about who they are, right? What their economy is like, what their, why they have this, because of the beef and all of that. And they're small. And they're small because they're, you know, kind of like bite-sized, because one of the things that they do culturally is have dinner late at night. So you'll go out and have an empanada and talk it over with something. So you don't want something too heavy, right? They have dinner at around 9 o'clock at night. So of course you don't want a big thing going on. And they have these small empanadas, and they're not very spicy, just, kind of a little muted, perhaps. Then you travel to Chile, for example. And in Chile, it's a long country, of course, many of you know, it's a coastal country, lots of beaches, and to the south, it's a little cold and chilly, right? And there's a lot of rain going on. So what do we want? A hearty meal. So empanadas in Chile are an actual meal. They're huge. They're probably the size of your whole palm, compared to Argentina, which is not really the same thing. And we are influenced in the south of Chile by some German inhabitants that came to Chile. So our empanadas have raisins in them, right? Or many times in the south have raisins in them because we have a different type of palate. And again, they're not very spicy, all right? And that tells you a little bit about who we are as people, all right? We are dough lovers, bread lovers, and that also translates into how does health look for these people, okay? Why is perhaps one disease prevalent over another? And that could have to do with that. And the further north you go, when you're traveling into Peru and Colombia and Ecuador, the spicier these empanadas get. And the more flavor they have, and they are sometimes filled with seafood, and it depends on where you go, the empanadas change. And so do the people. And I'm just telling you about this because not only is it, a fun thing to tell you, but also it's a really interesting way to look at our culture and how we are as a people, and how that's going to help you understand a little bit behind the story of your patient in the future. Okay. I was just talking about how many Spanish speakers there are in the US, okay? And I think it's not just us telling you about this language gap, but also, I have this quote here from the AMA Journal of Ethics that talks about the realities that doctors face today. And it says here that a Spanish-speaking doctor fills a critical nationwide gap, opening the doors of communication between doctors and patients. And I think that's something that is really important to keep in mind. When I was talking about the number of patients, excuse me, in the US today that are potentially going to be your patients in the future, that might not be able to communicate appropriately with you is huge. Okay, and with COVID, especially through COVID, we've seen how important it is to be able to connect with your patients, with the Spanish-speaking community. Well, it's really important to have as much opportunities for all kinds of second language speakers. We do concentrate on Spanish because of the sheer numbers. Okay, we're talking about over 50 million Spanish speakers in the US, considering the second largest Spanish speaking population in the world. And that's why we are concentrating specifically on Spanish. But we know that there are tools that are, we're very thankful for. Language line interpreters, gadgets that do some interpretation for us and translate for us, but there is something missing or something added sometimes. It's not always ideal, right? With a language interpreter, it takes a long time to get them on the phone. Sometimes, considering the time available for each doctor in an ER, for example, how long does a doctor have with each patient? Can we say about 10 minutes tops? Because they're very busy, and especially today with COVID and everything that's going on, there isn't a lot of time per patient. Okay, so if we add to that the doctor has to find an interpreter, dial in, there go your 10 minutes, right? Or there goes a chance to be with somebody for another 10 minutes. Then for the patient, on the other hand, it's going to mean that there is somebody else involved in their healthcare. all right? It's already difficult to add somebody or to open up sometimes on personal issues with a healthcare provider, never mind an extra person on a phone, that's sometimes on a speaker phone, that the person, you know, in the place next to you that's only got a curtain separating you is going to be there. So a lot of this is lost, a lot of the intimacy, a lot of the privacy, a lot of the translation sometimes isn't the same. All right. And so as much as we are very, very grateful for all of these technologies, there's nothing like being able to connect directly with your patient. Okay. That's what we're here to do. That's what our program is about. That's who we are. And I hope that I've given you a little bit of background. We're going to continue now, but I am going to ask Carolina to play a video. And like I said, our mission is to prepare professionals for a modern America that comes in all shapes, colors, sizes, languages, and everything else. All right. And I think it's great for us to tell you all of this information, but I'd like you to hear it from some of our students. Carolina's going to play a very short video, so please stay on the line with us and watch this video. It's about 2 minutes or 2.5 minutes long or something like that. Not very long, but I think it's really eye-opening when you hear people that have already done the program. What do they say? What do they have to say? How did they feel with this program? What did it bring to them and to the table for them? And that might be eye-opening for you as well. That might give you the opportunity to think of maybe some questions that you'd like to ask. And we'll be right back in about 2 or 3 minutes. Okay, enjoy.
This program, it was honestly awesome, you know. You get here and you're so nervous. It was my first time out of the country. I had no idea what to expect, what I was going to be doing, anything. I didn't know any Spanish before I came here. But when I got here, like, everyone was so supportive. I learned Spanish, I feel like, very well. You get here and you're in this entirely new place, and you know, it's like you have to learn Spanish, and you do, because you are immersed.
I chose this program specifically since it combined medicine and Spanish as well, and I'm currently a pre-med student. So this program was really unique that it offered Spanish classes as well as shadowing opportunities, and what I really took out of it was the shadowing opportunities. The school did a really great job of setting all of us up for great doctors to shadow with and to learn.
I love my classes. Classes are awesome, but definitely my favorite part of the program has been actually working and shadowing doctors in the hospitals here. It's awesome experience that you just really can't get in the classroom. Studying Spanish in the classroom is one thing, but actually living it out on the streets and in hospitals with people who, you know, speak it like that's their language. That's a totally different thing.
I was one of the students who was chosen to do a few 12-hour shifts in the emergency room. I saw a lot of really cool things and really excited that I got to do that. I also got to see a few surgeries with a gastroenterologist. So yeah, my experience here has been really great, and I wish I could stay longer, but yeah, everything's been great.
Hola, me llamo Kendall, soy de Dallas, Texas, y estoy estudiando biología y filosofía a la Universidad de Texas at Austin. I really wanted to see what the healthcare system was like in a different country. So my first shadowing experience, I just sat down in the clinic and watched the doctor kind of do his thing. I saw a surgery where they removed the entire gallbladder. I saw a gastric sleeve surgery. It was really, really cool. And it was very awesome to see the dynamic between all the doctors and the patients as well. Like in the clinical setting, it's so different than in the States. My classes at Acela are very small, just a couple of people. We usually talk through a couple different topics using the verbs or the grammar that we're learning that day. We talk about really cool and interesting issues that are happening in the country. The other day we talked about like survival tactics. It's conversations you would have in real life, not just like ordering at a restaurant.
Hola, soy Grace, and I'm studying biology and chemistry at the University of Illinois. I love the classes because it forces you to talk all the time, and that's something that I've never had before in a classroom. and the teachers are super good at kind of hearing the things we're struggling with, so they accommodate you during class with things that we're having a lot of trouble with. And yeah, I've just seen my speaking abilities just skyrocket while being here, and yeah, the teachers are phenomenal. I really like shadowing and just comparing kind of different healthcare systems, because I've only seen one in my life. So just seeing the relationships with doctors and patients here, I really like how it's closer, and it's something that I definitely want to strive for, like in my own practice or just experiences at home.
Great, thank you, Catalina. Thanks for that. I'm going to just be putting my screen back on here. Give me a quick second. I think it's really interesting to hear from these students, to understand what it was like for them, what they had as an experience. And I especially always point out the last student when she said, I'm taking some of these things and hopefully putting them into practice, into her own practice. And I think that's wonderful, because there are so many things that you can learn beyond the language, about a culture and about who you are, and putting those things together and making an entire you, not just, you know, a half sort of lived experience. And that's really why we have this program. And we, like I said before, we believe that culture and language go hand in hand. You can't have one without the other. I always make the analogy of, you know, when somebody is telling a story in a group and, you know, they're speaking in English, you understand perfectly, everybody's laughing, but you're not, because you weren't there or you had to be there. That's kind of like what happens when you learn Spanish away, when you learn from a book. There's always that sensation, that piece, that part that's missing. And that's why we bring you to South America. That's why a lot of the students on this video said, you know, it happened so quickly. You know, I've been here for, you know, an X amount of weeks, and I'm able to communicate. I'm able to hold my own. And that's really a really big part of what we do, right? So we have a program for you that involves a lot of different skills and a lot of different areas. And so, of course, you're going to improve on your language skills. As a matter of fact, you're going to go up 3 levels in this 9-week course. Right? That means if you started at a Spanish 101, you're going to end at a 201 or finish a 201, which is wonderful. And that happens in 9 weeks. So that's basically 3 semesters crunched up into 9 weeks. And it's incredible how this happens, because you're in the atmosphere and we're providing you with the tools that you need to practice on a daily basis, on an hourly basis. Every minute you eat, you breathe, everything in Spanish. So of course, you're going to advance a lot more quickly. All right. Cultural empathy is something that, you know, we've been bringing up quite a bit today. And that's huge, because it does tell you a lot about who we are as a people in Latin America. You know, one of the things that a lot of students are sometimes a little surprised about is the way we relate to one another here in South America. So we're a very touchy-feely group of people, and it's not uncommon for us to say hello to our healthcare professionals with a kiss on the cheek and maybe even a little hug. We talk to one another about you know, what's going on in our lives. We tend to know what's going on also in our health provider's life, and that's okay. And, you know, when we communicate, we do so with our hands, like you've seen me do a lot. And we are touching each other's, you know, shoulders and our hands and that kind of thing. It's normal, it's natural in our culture. So that could be quite different than what you're used to. And it's so important, because a Latino is going to make sure that he has or she has that bond with their healthcare professional before they trust that person, because they feel, or maybe I should say we feel, that as we create that bond, I am providing you with my life. I'm putting my life into your hands, my health. And that's quite intimate for me. And if you can't share in that intimacy, then I don't know if I can really trust you with this precious, precious gift I'm giving you. So that's a big part of who we are as people. And I think that that's really important for us to be able to create that or pass on that trust. Okay. You will get a college transcript for your work here, and that'll help you hopefully stay on track. You can use it for your undergraduate studies. A lot of you like to keep that transcript and use it for grad school, and that's fine. The program is short. You don't have to skip a whole semester, a whole gap year to take the program, although some students like to stay a bit longer and decide to do a gap year, and that's fine as well. But you can do this program in 3, 6, or 9 weeks. 9 weeks is our staple program, and that will get you to a good level, a conversational level of Spanish. All right. And of course, this program is focused for health professionals. And that's why we've added these linguistic extras that we call. That is shadowing doctors, a research opportunity, and volunteering, which we'll go through in a little bit. But all of these are focused on providing you the opportunity of seeing the language used in the healthcare environment. All right. So like one of the students says, it's not like you're learning to order at a restaurant or buy food at the supermarket, but you're also learning how the language is used in a clinical setting, which is exactly what we want you to do. We want you to be able to recognize those words that perhaps are not, that language that perhaps isn't in the books, right? Because you're going to have the word stomach in the book, but you might not have tummy or belly and those kind of words. And avoiding false cognates is also something that we put a lot of emphasis on. Okay, the word embarazada means pregnant, and it sounds a lot like embarrassed, but there's a big, big difference in the meaning of those words. And you can all imagine how something could go terribly wrong when you confuse the word pregnant for shy, right? And so we put you with doctors so that you're able to understand not only the language itself, but also in the context of a clinical setting. You're also able to understand and view the culture of how doctors relate to their patients here in Latin America. The research opportunity gives you the chance to understand how the people of Latin America may have a different perspective on health. What is it about these people that makes them more susceptible to certain illnesses or diseases? Okay, do they have access to healthcare, to nutrition, to water, to hygiene, all of these things that are going to be very important for you to be able to diagnose patients in the future. All right, and then volunteering, which is always about giving. I think that, you know, we all have volunteering opportunities in our everyday lives, but this one is special because you get to give back to the people, to the community, to the culture that's hosting you. It's our way of giving back to the community and saying, hey, thanks for having me. I really enjoyed being a part of this group, of this family, of this culture. Because we, like I said, we're very touchy-feely, so we're going to make you be a part of this great big Latino family. It's going to boost your self-confidence because not a lot of people get to travel on their own at a young age. It's going to force you to step out of your comfort zone, and that's really important. Not to mention the group of friends that you're going to make, people that are going to be your future colleagues that are also taking the classes with you. And it's an experience that you won't forget. These are people that I'm sure that you will keep in touch for a long, long time. It's somebody who you've had this once in a lifetime experience with that are going to follow you hopefully through your years as colleagues. Okay, I'm going to take a quick break to ask my staff if there are any questions that we have so far I do have a couple more slides and I'll try to make it quick because I don't want to go too far, but let's see if there are any questions for me. If you can read them out for Karen.
Patty, I've got a question here from Daniela.
Uh-huh.
She's wondering what type of visa she would need to apply for before visiting the countries.
All right. Okay, that's a really good question. You want to, if you are carrying a US passport, you don't need any kind of special visa. You can come in on a tourist visa and that will suffice. If you have a passport from any other country, check with your advisor, with your shadow abroad advisor, or you can connect with the embassy, your local embassy, to request information with regards to traveling to Chile. But like I said, if you're holding a US citizen passport, you should be fine for all three of the countries that this is being held in. Okay. All right. Are there any other questions?
Yes, I have a question here from Sammy. She says, hello, my parents are from Puerto Rico and I'm interested in the Heritage Program. I wanted to see if there was any opportunity for financial aid or scholarships.
Okay, great. Well, there's Sammy, there's two things that you're putting up, and I will talk about the Heritage Program in a little bit. The Heritage Program is available for those of you who are advanced Spanish speakers or who have learned Spanish by speaking it at home. Perhaps you don't have some formal training, but we'll go into that a little bit further. And in just a few minutes, I will talk about some limited financial aid through us. Okay. Actually, there's small scholarships. It's not actually financial aid, but we'll talk a little bit about how we can help you with the financial part of this program as well. All right. Thanks, Steph. Any others? Cassie, do you have one by any chance?
Hi, Patty. Yes, we have a question from Daniel. He's asking how many credit hours he would get from doing our program.
Oh, okay. That's a really good question. Yeah, like I said, it depends on how many weeks you're going to be doing the program. This will take you up 3 levels. So every 3 weeks, you're going to go up 1 level. You're going to do Spanish, for example, 101, then 102, then 201. It depends on your homeschool. I would definitely connect with your homeschool advisor, Daniel, but on average, you're talking about 3 to 4 credits per level, right? So you're talking about between 9 and 12 credits altogether, more or less. All right. I hope that helps. All right, so let's continue. I see that in the chat box, there are definitely several more questions, but I do want to continue. I think I might be answering some of them with my next few slides, and I don't want to take up too much of your time. But like I said, one of the things that comes up a lot, like we just talked about, and Stephanie's student there was asking, was about financials. And we are a not-for-profit organization, so what we are able to do is provide you with a student-friendly 0% interest payment plan, which means we upfront the money for the cost of the program, and you're going to pay us back in installments that have no interest at all. You don't have to do a whole bunch of paperwork with this. You can get this sort of credit through us. You don't have to go through a banking institution, but they are limited. All right, because again, we are not for profit, so we don't have, you know, unlimited funds, but we do try to help as many students as possible. And there are some scholarships that we have, partial scholarships that we do have available. If you are interested in applying to either the payment plan or the partial scholarships, you can definitely speak to one of our advisors. You can write down in the chat box, you know, interested in talking about finance and that kind of thing, and we'll get somebody to connect with you as soon as possible. Also, we have invited several people from our AMSA clubs out today. I think there may be some of you out there. We are a part of the AMSA Alliance. All right, so if you are an AMSA student, if you've come through an invitation through your club, talk to your advisor and we will definitely discount your application fee, and you do have an automatic $250 scholarship. All right, so if you are a member of the AMSA club, let your advisor know, let your Shadow Abroad advisor know, and we will do that for you. And I see a lot of people saying, oh, I wish I was in AMS. Okay, yes, I understand. But you know what we'll do? I can't give you all the $250 scholarship, but what we can do, if you apply by the end of the month, let your advisor know that you were at this open house, and we will allow you to, we will not charge you for that application fee. Okay, we'll give you 100% off your application fee. All right, so again, if you are going to apply by the end of the month, let your advisor know that you were here with us and say, Patty said that I could apply for free. All right. Okay, it's really important for us to be working with students that are aligned with our mission. So if what I've been saying today, if what I've been describing to you with regards to the program and to who you're going to become after this, who you're going to be after this, if they resonate with you, if this is something that you think is what you're looking for, I suggest that you apply soon, because the spots are limited, not only the spots for the scholarships and the finance plans, but also our actual spots, because shadowing is limited. So we can only have 25 students per date. So if you are interested, please let us know, hopefully soon, so that we can get you started. One of the other questions that comes up a lot is about safety. I know some of you are out there watching this with your friends and your families and perhaps your parents. I have college-age children myself, so I understand what it's like for a parent to say, hey, you're going to be going to the other end of the world. You're going to be far away from me. Where is this place? You know, where am I sending you? And I think that it's really important for you to understand that we, really believe that safety comes first. Okay, so all of our schools are located in upper middle class neighborhoods in Argentina and Chile and in Peru, so that students are able to go out without having to look over their shoulder. They're able to explore the surrounding areas and get to know the locals, because that's a really big part of your learning experience. All right. And so it's really important to us that our schools are well located, but also our staff is very seasoned. And when you arrive, you will get an orientation session that will let you know where where the ATM machines are, where you can find banks, how to move around the city. So we're really going to be telling you over and over again, where to go, what to do, and that kind of thing. All right. Also, you will be getting together with the people that are traveling. As a matter of fact, we are having our first open house for students that have already signed up to the program. We have them every few weeks to let the students know what paperwork needs to be done, how to prepare, what to pack, what to bring, what not to bring, what documents are necessary. And that gives you all the opportunity to meet one another as well, and to look forward to perhaps traveling together or bunking together. And that's just a great thing to have, knowing that there are other students that are in the same boat you are, that are going to have that same experience. All right. So I just wanted to recap our program. This is a AAMC compliant program. The 2022 program includes 3 levels, 3 courses of Spanish. It's 9 weeks. It includes your medical shadowing, a healthcare research project, and volunteering opportunities as well. Classes go from Spanish 101 to 302. And if you are an advanced Spanish learner, if you learned Spanish growing up in a Latino household, perhaps the Heritage program is for you. And the way this works is that you will connect with us and go through the application process. And once you have been accepted into the program, etc., we will provide you with an assessment. All right, it's an online assessment that you write down, but you will also meet with our academic coordinator just to make sure that we are providing you with the correct level of studies. All right. As I said before, we do have very limited spots available. As a matter of fact, for summer one, the session starting on May 29th, we have very, very, very few spots for that. So if you are interested in that date, I suggest that you connect with our advisors as soon as possible. And we do have more spots available for summer two. We have a fall semester or fall quarter program as well. And if you are looking for a gap year program, we do have that available in any of the above dates as well. So if you have any questions about that, we're happy to answer those questions for you. And again, just to recap, you can visit our website at www.spanishandmedicine.com. All the details of the program are there. The core program includes going to Argentina, Chile, and Peru. There are 3 courses. Medical shadowing is, of course, a part of the program, as well as the healthcare research project. Travel between countries is included. All right, so you have to get yourself to the first location in Chile and home from Cusco, from Peru. But all of the travel in between is a part of this tuition as well. And don't be afraid, this isn't one of those crazy, programs that is going to cost you over $30,000. You'll be happily surprised when you visit SpanishandMedicine.com, where we have all of the information with regards to costs and everything, all of the details of what is included. It says there that you will also get 4 nights of hotel stay in each of the locations. So that takes the burden off of having to find perhaps or not be happy with your selected accommodations. All right, so that's something that we can work out with you, with your advisor. We're just over the 45 minutes that I always try to promise. So if you do have any questions, please feel free to connect with us. If you'd like more information, please write, more info on the chat box, and one of our advisors will connect with you as soon as we can. I hope this has been a little bit of an eye-opening experience for all of you. If you'd like more information, please write so in the chat box. We're happy to have maybe a Zoom call with you, or a phone call, or just an email, whatever works for you, to provide you with those details that I may have not given you at this point. I tried to connect with as much information as possible, but it happens. All right. So I hope everybody is having a wonderful week. Please stay safe. Nos vemos en Sudamérica. Gracias. Adiós.
Ciao.
Ciao.